Thank you, Mr. Chairman, for bringing this hearing. And I want to thank the dedicated doctors today for their lifetime of work and study and passion. We are a grateful nation for all of your lifelong commitment in fighting disease, not just in the United States, but around the world. And, you know, as I talk to Nevadans about safely reopening the economy, one question that frequently comes up is when are we going to have a vaccine, like everyone's talked about? In Nevada, travel and tourism, of course, the lifeblood for us, and the jobs associated with those industries can only fully come back if we know it's safe to travel and visit or work at our hotels, casinos, restaurants, and attractions. Ultimately, to make this happen, we have to build confidence in our visitors that it's safe, we need a vaccine, and that research is extremely important. However, understanding that this takes time to develop and ensure both safety and efficacy, I'd like to hear more about what research is happening regarding preventative medication research that could be helpful in the time frame before a vaccine, and especially before one is widely available. So I'd like to ask if this could be part of the path to helping us begin to reopen our economy safely and bring visitors not only back to Nevada, but across our country. So Dr. Fauci, what research is currently happening to identify potential monoclonal antibody preventative treatments or other therapeutics? If the right antibody is identified or can be identified, could this be used as a preventative medication to block COVID-19 virus from latching onto those host cells, much like the treatments for rheumatoid arthritis, severe asthma, or other diseases? And secondly, would preventative medication options like this help complement the effectiveness of a vaccine once it's available?
Yeah, so thank you for that question, Senator Rosen. That's an excellent question. And in all of the therapeutic interventions that we are developing, and you mentioned several of them, they could be direct antivirals along the line of remdesivir, but that's just one of a number of possibilities since there are several viral targets in the replication cycle. Using convalescent plasma in a preventive modality, as well as monoclonal antibodies in a preventive modality, are in fact all feasible and will be pursued in parallel with the development of a vaccine. The model of using drugs and other interventions that are effective for treatment is really a great success story in the issue with HIV/AIDS, because many of the interventions that were developed for the full treatment of an infected person are exquisitely effective in preventing infection of HIV. So that's the kind of model that we work out in parallel with treatment for disease. It's the using as treatment as prevention. I believe that will be a part of our effort at the same time as we're putting a full court press on trying to get a vaccine. So it's an excellent question, very relevant.
I know I have a short time left, so I'm just going to kind of abbreviate this. The second most important question that I get, not just from our first responders and people worried about work, but generally, what does the next generation of PPE need to look like for all of us as we go about our lives, not just as workers? Depending on your work, you may need something stronger, more specific, but as all of us, as we want to go out and shop or out to eat or whatever those things are, get on an airplane, should masks be made of a certain material? Gloves, are handkerchiefs effective? Can you talk about PPE for the general public?
Well, you know, the best PPE for the general public, if possible, right now, is to maintain the physical and social distancing. But as we've said, and I think all of us would agree, there are certain circumstances in which it is beyond your control when you need to do necessary things, like go to the drugstore and get your medication, go to the grocery store and get your food, that in fact you need some supplementation to just physical distancing. And that's the reason why some time ago, the recommendation was made, I believe it was Dr. Redfield at the CDC who first said that, about getting some sort of a covering. We don't want to call it a mask because back then we were concerned we would be taking masks away from the healthcare providers, but some sort of mask-like facial covering, I think for the time being, should be a very regular part of how we prevent the spread of infection. And in fact, the more and more as you go outside right here and where I'm sitting in Washington, D.C., you can see many people out there with masks on, which gives me some degree of comfort that people are taking this very seriously.
Thank you.